Thank you and welcome to this short video presentation on CHG bathing. CHG bathing is performed on all patients with central lines, PICC lines, vas caths, Mediports, and urinary catheters throughout the hospital. In this video, I will talk about why we use chlorhexidine gluconate, also known as CHG, how to perform a CHG bath, compatible CHG products at Christus St. Vincent's Hospital, documentation, and considerations. Why use CHG? To reduce healthcare-associated infections. Chlorhexidine gluconate is an antiseptic that has broad spectrum activity against many organisms, including Staphylococcus aureus and Enterococcus. Unlike many other antiseptics, CHG has residual antibacterial activity, making it ideal for decreasing the microbial burden on patients. The 2% no-rinse cloth appears to be more effective at reducing skin colonization than a 4% CHG solution that must be rinsed off. CHG bathing can be done before a bath, after a bath, or in place of a bath, and is done once every 24 hours. When additional bathing is needed or requested, use only CHG-compatible cleansing foam, lotions, and barrier products. Soap and water will deactivate the CHG ingredients. Apply CHG cloths with firm massage. This binds the antibacterial ingredients to the skin proteins and prevents bacterial growth for up to 24 hours. Do not rinse off. After routine washing of the face, hair, and peri area, remove one package of CHG cloths. There are 6 cloths in each bundle. Cloth 1 can be used for the neck, shoulders, and chest. Cloth 2 can be used for both arms and hands. Cloth 3 can be used for the abdomen, then the groin and perineum. Cloth 4 can be used for the left leg and foot. Cloth 5 can be used for the right leg and foot. And cloth 6 can be used for the back of the neck, back, and then the buttocks. Use only CHG wipes below the jawline, and do not use CHG cloths on mucous membranes such as the periurethral area and faces. Compatible CHG bathing products and shampoo caps can be found throughout the hospital and in designated warming cabinets. Please remember to place CHG cloths in a warming unit that is designated for CHG wipes. The back of the warmer should be set for the setting C, which stands for CHG. Please note that CHG cloths expire after 84 hours, so please take cloths from the flashing red lights first. Please remember to place shampoo caps in warming units that are designated for bathing. The back of the warmer should be set for B, which stands for bathing. Shampoo caps do not expire. Documentation. How to chart a CHG bath in Epic. Under Flow Sheets, go to Daily Cares and Safety, click on Hygiene, and find all your bathing options. Or, under Flow Sheets, go to the Simple or Complex Assessment. Under Pelvis, click on Urinary Device Catheter Care, open Hygiene, and find all your urinary catheter care options. If a patient refuses a CHG bath, this must be documented in the comment section. Alright, here's a picture of how to chart a CHG bath in Epic. In your Flow Sheets, go to Daily Cares and Safety. And when you get to Daily Cares and Safety, go into Hygiene, and Hygiene will give you all these options for patient care, including a chlorhexidine bath. Here is the other option for charting a CHG bath. Under Flow Sheets, you go to your Complex Assessment or your Simple Assessment. You go down to Pelvis. Your patient probably will have a urinary catheter. And then under Pelvis, you go to Hygiene, and over in Hygiene, you have the options for pericare catheter and your chlorhexidine bath. Considerations. CHG wipes must be discarded from the warmer after 84 hours. Red light will be flashing. CHG wipes are not to be used for the periurethral area, faces, or mucous membranes. CHG baths are required once every 24 hours for all patients with urinary catheters, PICC lines, central lines, and vas caths. All critical care patients will receive a CHG bath within 4 hours of admission, even if they currently do not have a urinary catheter or central line in place, and then daily. CHG cloths may be used for tubing such as urinary catheter, drains, gastrostomy tubes, rectal tubes, chest tubes within 6 inches of the patient. CHG cloths are warmed for patient comfort. CHG cloths may be used at room temperature for febrile patients. Inform patients their skin may feel tacky for 1 to 2 minutes due to the emollients and aloe. This tacky feeling will go away. Please do not flush CHG cloths in the toilet. If a patient cannot have a CHG bath due to skin breakdown, allergy, etc., an alternative bathing method must be used and documented. Plastic hospital basins are linked with hospital-acquired infections. A study analyzing basin samples results of 1,103 basins from 88 hospitals across North America found that almost 2/3 of bath basins studied were found to harbor at least one pathogen commonly associated with a hospital-acquired infection. 62% of the basins were contaminated, 35% of the basins were colonized with VRE, 45% of the basins were colonized with gram-negative bacilli, and 100% of hospitals in the study had basins that tested positive for bacteria. Please remember it's best practice to never reuse a plastic basin and never use the sink to give a patient bath. And always remember, the daily risk for CAUTI from an indwelling catheter increases from 3 to 7% on a daily basis. Thank you for your time and attention to this very important matter and for keeping our patients safe from hospital-acquired infections.